Hello aspirants, I am Indumati Karthikeyan from InKar IAS Academy. Today we are going to see about the 13th November 2024 current affairs. It's from Delhi edition. So today the first news is debating the healthy longevity initiative, which is comes in the GS2, that is issue relating to development and management of social sector, services relating to the health, education, human resources, and also comes under the another GS2 topics, government policies and intervention for development in various sectors and issues arising out of the design and implementation. First, we must note down that the divide between the real world and the strategy to be adopted in the healthy longevity initiative is too wide to be ignored. Once in a while, the World Bank publishes a visionary and profound report on an important aspects of human well-being. That is, what is healthy longevity? Then why it's very much important? Briefly saying, the healthy longevity entails sharply reducing avoidable death and also avoid the serious disabilities throughout the life cycle, as well as it will increase the levels of physical, mental, and also social functioning through middle and older ages. And another short period of time before inevitable death. This is the main concern regarding the longevity initiative. Is a World Bank unlocking the power of healthy longevity. That is, once in a while, the World Bank publish a visionary and profound report that is saying unlocking the power of healthy longevity. That is the demographic change, non-communicable disease, and also human capital, that was published in Washington DC in September 2024. Why should we invest in healthy longevity? That is, we should include measures to control the non-communicable diseases such as heart attack, diabetics. These are the risk factor while contribute to a larger and growing burden of avoidable mortality. Increasing the in healthy longevity could save the 150 million lives in low and middle income countries and also extend the millions more by 2050. This is the main target, generating significant economic health benefits. For the while, we must know the global NCD crisis and the pathway of health longevity. The projection and current concerns projections suggest a global surge in death from 6.61 million in 2023 and 92 million in 2050, as well as related to increase its needs to NCT related complication and long term care in the hospitalization. If LMIC can achieve ambitious yet feasible rate by progress, the world could avoid 25 million deaths annually reported by 2050. It's effectively having avoidable death and meeting the related sustainable goal development, that is SDG. The healthy longevity initiative driven by his concern, the World Bank report proposes a healthy longevity initiative which takes a life goals approach. That is, briefly saying, healthy longevity entitles the sharply reducing avoidable death and also avoid the serious disability throughout the life cycle. While the World Bank report discussions, that is catastrophic health expenses happens, there is a very important concept, that is there is a very exploitive corrupt doctors world without quacks and exploitive hospitals, pharmaceutical companies pushing unsafe medicine and also patient to the chronic condition, traveling hundreds of miles in rare field. In the ideal versus real world healthcare scenarios, curiously, it imagine a world which healthcare is accessible. Doctor and nurses and paramedical staffs are competent, honest, and committed to proper patient care. Hospitals are well equipped. The monitoring of patient is systematic and also digitalized, and there is an awareness of benefit of yearly deduction and also treatment of NCD is a crucial step to take by the government, which controls the catastrophic health expenses and also the improvement happening in the future scenario. In case of elderly population, there is a much disease concerns because current demographic and trends. The older population of India currently the world's second largest, because we are having 140 million people who are aged 60 years and above, the 60 years. In the, by compared to 250 million people in China, we are, it's simple only, but consider another countries, we are also having the much population after China. So moreover, the average around annual growth rate of the older population is almost three times higher than the overall population growth rate in India. The consequence of these NCD surge among elderly, the swift descent of the elderly in India, that is 60 years plus, into NCDs. For example, cardiovascular diseases, cancer, chronic respiratory diseases, and also diabetics could have disastrous consequences in terms of the impoverishment of families, excess mortality, lowering the investment, and also give the consequent declaration of the economic growth. Worse, the government has to deal simultaneously with the rising fiscal burdens of NCDs and also the infectious disease. The sustainable development goal and health goals at risk nowadays. The report by Lancet 2018 emphasized the failure to devise a strategy and make timely investment now will jeopardize the achievement of the SDG 3, that is a good health and well-being. That is the SDG's third, the SDG 3 third goal. That is will target four of a one-third reduction of the premature mortality and from NCDs by 2030. Rising NCD morbidity and mortality, which will cause a severe risk in India. It rises steadily and slowly in India. In 1990, the NCD accounted for 40% of Indian mortality and now projected the account for three quarters of all death by 2030. Currently, cardiovascular disease, cancer, respiratory illness, diabetes are the leading causes of death in India, accounting for almost 50% of all death. It belongs to the NCD disease only. Common risk factors of NCD underlying these rising shares or growing risk are common in several NCD. These include tobacco users, alcohol abuse, and obesity due to sedentary lifestyles. That is using the junk foods. So the delta that getting be increasingly high in simple carbohydrate and saturated fats only present in the junk foods. Many population, particularly in remote rural areas, lack easy or frequent access of primary healthcare systems. So, who can provide regular screening for the common NCDs. Now consider what is the impact in the social security schemes. That is a focus on diabetes and heart disease. The focus here is diabetes and heart disease will be the writer of this article will examine that participation in the social security measures schemes reduces the prevalence of two specific NCDs, followed by whether utilization of the medical services, hospitals, and visits the hospitals also reduce the prevalence of the NCDs. The analysis is based on the Indian Human Development Survey only. The author says from this survey that is there is many obstacles are there in our public healthcare systems. There is no any supplemented by the longitudinal aging study in India, and also it's very much impact the social security and the medical access, even though pension amount or meager very smaller amount, they supplement scarcity also there, and also there is no money for the hospital expenses, and also for the treatment for such a disease like cardiovascular or diabetics. Hospital visits are unavoidable in these conditions. However, travel cost, fees, and cost of the medicines impose a huge financial burden, resulting in a large out of pocket expenditure will be indebtedness and gives a burden to the poor people. While health insurance is useful in restricting the financial burden, but its potential is far from fully realized due to limited awareness of the eligibility and requirement and the documentation, delays in the payments, and also the rejection in the claims. But diet, and also one more factor, the dietary risk factor is refined grain intake cause an increased risk of premature coronary artery diseases, while rice intake beyond the threshold causes diabetics. Higher intake of red meats such as beef, pork, and mutton also contribute the higher risk of the diabetes and also the heart diseases. Additionally, a rise in the price rations on fat dense foods like sugar and oil aggravates the risk of the both diabetics and also the heart diseases. Age gradient and lifestyle factors also is one of the reason. Confirming the age gradient, the risk of the diabetes and also heart diseases is positively associated with the age. The reason for the rise in diabetes with the age includes a sedentary lifestyles, huge calorie diet, and also visceral adiposity, and also the high genetic predisposition to type 2 diabetics amongst Indians, which appears in a younger age at lower BMI than in the Western population. We are forming that Ayushman Bharat scheme and health insurance challenges. Of particular importance of Ayushman and Bharat scheme, which aims to provide the health insurance coverage of the bottom of 40% household. However, it is potential has been far from fully realized due to inadequate funding, stringent eligibility requirement, and also the widespread of corruptions, as revealed in the Comptroller and Auditor General in 2023. There is a issue included large number of ineligible beneficiary delays, emphasizing empaneling the hospital surgeries performed after discharge and utilization certificates lacking, and also the competent authority signature also lacking. What is the way forward for this concern? That is Supreme Court of directives on hospital price regulation, as private hospitals are notorious for inflated prices in the healthcare. The Supreme Court of India directed the central government in February 24 to find ways to regulate the rates of the hospital procedure. The court emphasized the pricing decision must be informed by a benchmark for price determination, and also the price caps influence actors' behavior by enforcing regulation. These efforts tend to be temporary when enforcement mechanisms are weak. So we should uh, give the stringent regulation among the private sector hospitals, and also behavioral and lifestyle factors. We need to change our behavior and our lifestyle, lack of physical activity, and also taking the high calorie intakes. Obesity is also the major role in the cardiovascular diseases, and diabetes can exacerbate risk of respiratory disease such as emphysema and also the bronchitis. Limiting tobacco consumption can provide the individual health benefit, however, reducing the multimorbidity prevalence of a population level. It requires taxation on the unhealthy products. So finally, what we conclude, the policy reforms will be carried out. Anybody guess? It reflects the need for the both regulatory measures on the healthcare cost and also the broader public health policies, which will encourage healthy lifestyle to effectively addressing these non-communicable diseases and also increase our healthy longevity initiative. This is the main concern. Thank you.